Hi everyone, welcome to my Health Talks series, episode 5. I strongly encourage mothers to breastfeed their babies if they can. World Health Organization recommends to mothers worldwide to exclusively breastfeed their babies until the age of 6 and continue breastfeeding up to the age of 2. Our today's guest is Dr. Juhio, the resident pediatrician. Now the first question, why is it important to promote and support breastfeeding in a family with suspected or confirmed COVID-19?
Hi, I'm Dr. Juhio Hussain and I'm currently working as a pediatric resident. First of all, breast milk is the natural food for babies. It has the perfect nutrient composition for the babies and it changes along the way as the baby grows. Also, it provides immunity for the baby and it also helps prevent future risk of allergies, for obesity, for diabetes, for heart disease. So breastfeeding should actually be encouraged, even if you have suspected COVID-19 or if you have COVID-19. With what limited studies have been done, it has not shown that the virus is being transmitted through the breast milk yet. So further studies need to be done on that. But currently it is recommended to continue breastfeeding for your newborn. And also the most important thing is to practice hygiene. If there is skin-to-skin contact, just to wash your hands thoroughly and clean the area. And if you're unable to breastfeed directly, you could always express breast milk and make sure you're cleaning the equipment properly, and that should be enough. If you have respiratory symptoms, you could always wear a mask.
Absolutely. It has loads of health benefits for mother and a baby. As I have discussed on my previous episode, MMR vaccines do not cause the autism, as research shows. What are the other myths of vaccinations that you could share with us and guide the listeners?
There is no association between receiving the MMR, which is the measles, mumps, and rubella vaccine, and autism. This study that was done a long time ago has been debunked many times, and the doctor who also was involved with the study, his license has been revoked. There are many myths regarding vaccination. Another myth that comes to mind is the DTP vaccine and sudden infant death syndrome, and actually there is no association between the two. The myth came about because sudden infant death syndrome applies to infants, which is below 1 year of age, and you receive around 3 vaccines of DTP in your first year. So people linked the two, and that's where the myth came about that the DTP vaccine causes sudden infant death syndrome. But studies that have been done on it have compared the vaccinated and unvaccinated kids and the rates of sudden infant death syndrome. And in fact, it has been shown that the rates are slightly lesser in the vaccinated group compared to the non-vaccinated group.
The proven benefits of vaccinations far outweigh the potential risks and unfounded claims of danger. Therefore, it is extremely important to get information from the credible sources. Most common questions we get about the causes of autism, they're blaming on bad parenthood, cartoons, or if babies attached to the gadgets, and many other causes that parents believe that cause autism. Let's guide the listeners through this. What actually causes the autism?
It is largely believed to be related to genetics, although some environmental factors do seem to play a role, but mostly it's related to genetics, and it seems to run more in siblings and in families. It is diagnosed more in boys as opposed to girls, but girls seem to be more severely affected. Currently, there is no primary prevention for autism. These children most often benefit with medication treatment and with the educational interventions and social interventions and support groups.
Let's don't believe whatever we hear or see without strong evidence. Mothers often worry about their toddlers refusing to eat solid foods. They become pickier after 12 months of age. What could be the reason that babies eating less? Should we take time and be more patient about it?
So toddlers can be picky eaters, but it is also important to remember that they have a way of self-regulating the amount of food they're consuming. So as parents, it is important to provide the right amount of food at set times during the day, including healthy snacks, but not to get frustrated or force their toddler to eat if they're not eating the amount of food that is being provided to them. So it is important to discuss the amount of food that is being provided, and also to provide a proper routine for the toddler, so it becomes it is easier for them to follow, as opposed to giving them food at random times during the day. Also, the food could be provided in various ways. For example, the toddler might not like a carrot presented in a certain way, but maybe in a mashed form, or so the same food group that they would have refused earlier on could be presented in a different way. And just because they did not like something now does not mean they would not like it in the future.
Yeah, definitely. And hydration with water, especially in this heat, we need to hydrate our babies and introduce nutritious food. What are the essential nutrients that baby need for normal growth and development?
So for the first 6 months of life, breastfeeding provides all the essential nutrients and immunity that is needed for the baby to grow. After that, slowly mashed foods can be started, including fruits and vegetables that can provide added nutrients as well. And as the child grows, they can start taking in more solids. So, five main components for a balanced diet would be fruits, veggies, proteins, grains, and dairy. And the requirement changes as the child gets older. So it is important to establish healthy feeding patterns and habits from earlier on, because it does correlate to health issues later on in life.
It was very informative. Thank you very much. Have a good day. I hope you guys enjoyed, and if you want any other topics to be discussed, write comments below. See you soon.